you, Ambassador Bard, Ambassador Erasmus, and colleagues. I had 10 minutes, now it's 7, so here I go. I will talk to you about what we've done in Chile and what we've been working with within the perspective of adolescents' health. As Ambassador Bart said, I'm from NCDs, so I made a lot of investigation before coming to this meeting on adolescents. So the first thing is to share with you that for the second time in 10 years, Chile has developed the health objectives for the decade. This is now it's called the National Health Strategy 2011-2012, and it has 9 objectives. One of them is for non-communicable diseases, like you see here. And we have specific goals for cardiovascular diseases, for myocardial infarction, stroke, hypertension, also diabetes, and also for renal disease, reducing cancer mortality rates, and chronic respiratory diseases, disability, and deaths for traffic accidents. Maybe this one, the traffic accidents, is the only one where adolescents and young people are the major victims. The other ones are obviously older adults, not adolescents. The next. But the objective number 3 of the National Health Strategy deals with the risk factors. So we have specific goals for tobacco consumption, and I don't know if you can see, but we have one of the highest prevalence of tobacco consumption in the world. It's still there around 40% of the population, and it's even higher in the younger population. Also, our goal is for 2020 to reduce harmful use of alcohol in young people and adolescents, illicit consumption of drugs, to reduce children's obesity rates. Here we didn't go for adolescents or adults because it's almost impossible, but we are focusing on young children. And also to increase physical activity within the young, once again, the young population. And one of our one of the nicest maybe indicators is to increase the general health of our population. So we want to have an increase of 5 of the protective health factors from a total of 8. The 8 are, as we know, the tobacco, alcohol, physical activity, 5 portions of fruits and vegetables, plus no high blood pressure, no high glycemia, nor high cholesterol. So we want to increase to 20% the protective health factors on our population. Next. And we have specific goals to reduce suicide mortality in adolescents and also fertility rates. Next. Many of these goals, and specifically those that deal with risk factors, are naturally need a multisectorial approach. And this is where this program, which is led by the presidency, and it's actually led by the First Lady, similar to the Let's Move, it's called in Chile Elige Vivir Sano, and it has the focus on physical activity and also healthy eating in the context of family life and outdoor life. And it's mainly, one of the main activities is to create awareness of healthy living within the population, and most of their activities, 80%, are planned and executed through the ministries or other government agencies. They're not duplicating, they're coordinating, articulating activities. And also, something that is not very common, they have 20% of the activities have a support, financial support, or co-produced by with the private sector. Next. Other activities, multisectorial activities, I've chosen the most recent ones that affect adolescent and young health. One of them is regulations. We have a new law since 1 week, it's still not implemented, on food labeling. It's a modification to the last law which will make a warning for the consumer, that it would say if that product is high in salt, high in fats, or high in, what is it, what I'm missing? Salt and sugar, of course. Yeah. So that law had this article on physical activity, and in all the negotiations, it took 5 years to have this law, this new law, and they dropped the part about physical activity that included that you had a frequency at least of 3 times a week in so many hours. They negotiated that they will have a new law for this. We will see. We have, since less than a month, a new alcohol law, 0 tolerance, no drinking and driving, 0. And that's your friend, not your girlfriend.
Thank you for clarifying.
This has been, of course, the focus of this is especially young people, and we will like to see that this reduces traffic accidents and many deaths that shouldn't be. And also, we are discussing now in Congress a new tobacco law. This will be the 3rd modification to the original law, which will have public places free of tobacco smoke. Today we have separate spaces. So that will be, I think that will be soon enough a law. Within the Ministry of Health, we have since maybe 1 or 2 years, not more than that, a national adolescent program. Not with one person, but with a team of people. And this is greatly, Matilde Madaleno has very much to do with this in our country. We also have an advisory, a board or council with adolescents from all over the world in the Ministry of Health as advisory board. We also, this year, started the health examination for the youth. We have health promotion community programs, and a lot, we've received for this, for the adolescent health, a lot of international collaboration, as you see there. We also have a National Institute of Youth, Institute of Sports, that they have activities, after-school activities, competitive sports, or just physical activity for children. And within the Ministry of Education, they also have advanced in physical activity. They have this quality evaluation of physical fitness of kids, which is not very good, so this will help for maybe this new law to have more hours and frequency of physical activity hours. And the last one, I wanted to really show you, maybe many of you have read or heard, seen in the news, that we've had really a lot of student-led mobilizations. They started in 2006 with high school students. We called it the Penguin Revolution. And now, last year, we had this same, this another mobilizations. There's university-led this time. Maybe they're the same ones that came from school, 2006. And they want better, to have, they're advocating for a lower price of education, access to better quality public education, and also more equity in general. So adolescents in our countries, I'm sure they're going to be agents of change.